Back to this interview now. COVID-19 control measures, including lockdown, led to increased experiences of stress and anxiety among adolescent girls and young women. This is based on the study by the University of Cape Town and the South African Medical Research Council. The study was conducted between November 2020 and March 2021. Now let's discuss this with Dr. Zoe Duby, the lead author and honorary research associate at UCT's Division of Social and Behavioural Sciences. Dr. Duby, thank you once more for your time this evening. I just wanted to start off our interview with why it was important for you as well as the Research Council and UCT to conduct this research and how it was done.
Okay, thank you very much. So we were conducting this research as part of an evaluation of an intervention targeting young women in various provinces of South Africa, in some of the communities which have the highest HIV prevalence amongst this specific age group. So we were focusing on young women between the ages of 15 and 24 in these high priority areas, as they were. And we were looking specifically at educational and sexual health outcomes. So reducing teenage pregnancy, reducing HIV transmission or incidence amongst this group, and trying to keep girls in school. So when we were doing this research, evaluating these programs, we discovered these other problems arising. And it happened that, COVID arrived amidst while these programs were being implemented. So in our evaluation research, we had the opportunity to look at some of the factors and how COVID itself and the pandemic affected these young women's lives. And one of the key findings that we had was relating to the mental health, the negative mental health outcomes that COVID had in this population.
Doctor, maybe if you could just take us through some of those findings from the research paper.
Yes, certainly. So the research involved a survey and as well as qualitative interviews with young women. And the paper that we are speaking about in this sense focuses on the intersections between what we call socioeconomic stresses. So things like food insecurity in households, poverty, unemployment, and how that links to mental health outcomes. And we found that young women experienced a great deal of anxiety and depression, particularly in the lockdown period. And this obviously negatively affected their life in other senses. But these already very poor households were thrown into enhanced stresses in this time, where obviously they lost household income, where food security was an issue. And we looked specifically at how this affected young women's mental health and well-being. And particularly one of the things we found was increased risk of gender-based violence in the household, as well as issues around access, obviously, to education in households that didn't have access to any internet, didn't have data, so young women were not able to access any remote learning. So just really the households in the country that are already so disadvantaged socioeconomically were experiencing these additional stresses.
Doctor, of course, the research also picked up some positive outcomes, I guess. Resilience, I see, was something that came out quite strongly.
Yes, so that's something really, really exciting about this particular piece of research, that it's not only looking at these dire situations, but we found in young women's stories these narratives of resilience, of how young women employed coping strategies in order to deal with their situations, in order to overcome this increased depression and anxiety that they were experiencing. And that was a really hopeful finding. So what we really are trying to do with our research is make recommendations for how these positive coping mechanisms can be supported. And young women have shown such resilience. Obviously, this was not the case amongst all young women, but it's really incredible that even in these situations of incredible hardship, how some individuals have this wonderful resilience, and that is often enhanced by supportive family networks, supportive social networks, and supportive community networks. So that's something that we can really, we would like to see more interventions that work to bolster that resilience in these communities as a coping mechanism for the future.
Yeah, are you perhaps able to take us through some of those coping mechanisms? I think they could be really useful for somebody who's going through a lot of stress right now.
So some young women found that just by reaching out to others around them, so communication was a key issue, that young women who felt that they had someone to talk to and that ability to reach out for help. And I think it's, you know, on a personal level, some young women just managed to keep a positive outlook, and they had faith that things would get better. And it's really that kind of positive view that helps people get through these times of incredible hardship. So not losing sight that there is a hope that things will improve in the future. And those people who managed to use the resources around them, we found that mothers were actually a wonderful support mechanism for those young women who had mothers, could get emotional support, and that emotional support really helped young women to get through these situations. So I think in terms of, you know, messaging for what young people can do to harness this resilience, I think this is something that we really need. Not every young person has the opportunity to have support in the household. And how can we as researchers and as public health practitioners, as mental health practitioners, provide the support to young people that they really need? And this is something that we are urging the government to look at closely, because we believe that adolescent and youth mental health is a very underserviced area of the public sector. And we would really like to see more attention paid to that, so that we can build on these young people's natural resilience.
Research reports. Thank you so much for your time this evening, Dr. Zoe Duby. I wish I had more time with you, but we need to move